Abby. I'm going to be your nurse practitioner today.
Nice to meet you.
What's your name?
Hunter Cronin.
Okay. Can you tell me how you got here today?
I drove here.
You can't see me. Okay, so you drove here. Can you tell me what brought you in today?
I just need to get a head-to-toe assessment.
Alright. Can you tell me what today's date is?
November 19th.
Alright. Do you have any allergies?
No.
Do you have any medical problems?
No.
Do you take any medication every day?
I don't.
Okay. Do you drink or smoke?
I don't.
Do you use any drugs?
I don't.
Okay. I can't see. Alright. So I'm going to wash my hands now. Washing my hands. And then I'll provide privacy for the patient. And we're going to start by, I'll examine your head. So I'm going to touch your head. We're just feeling for any masses, looking for lesions. We can see that he's got a normal hair distribution with some thinning of the hair, but he contributes that to his genetics. We see that the head is symmetrical, his ears are symmetrical on both sides. We're not seeing any lesions or masses, no abnormal wounds on the head. The neck is midline. We're also looking at the skin. He's got a normal skin tone, normal for his ethnicity. He's got a normal build. He looks healthy. He's well groomed and well kept. We know that his speech is fluent. He's able to answer all my questions correctly. He is alert and oriented. Let's see. And now we're going to move on to the eyes. So in a normal exam, I would have ophthalmoscope, and I would check the optic disc by using the ophthalmoscope, standing at the side, having the patient looking directly ahead. And then I would use the light of the ophthalmoscope at a 15-degree angle looking for the optic disc. We would also be using the pen light. Let me see my light. We'd also be using the pen light to check for accommodation and constriction of the pupils. So I'll have the patient look straight ahead, and we see a normal constriction here. Very good. Also in a normal exam at this point, I would check the patient's visual acuity. So I would do that by using the Snellen chart, which I don't have. But the patient would stand 20 feet away from the Snellen chart and read the Snellen from using the left eye and then using the right eye and then using both to get their visual acuity. Also in a normal exam, we would check the nearsighted vision. So I would do that by having the patient read like a newspaper. Visual acuity. Hold on. We're also going to check for accommodation. So I'm going to have you look at this pen and follow it in to your nose. So the patient has normal accommodation. He's able to follow the pen all the way into his nose. Now I'm going to check your peripheral vision. So you just follow the pen, follow the tip of the pen. Very good. And he's able to follow the tip of the pen. So now also I'm going to look for any drainage from the eyes. We're going to look at the sclera. Just going to pull down. He's got normal pink sclera or white sclera and moist membranes. There's no drainage. There's no masses or lesions on the eyes. He's got normal hair distribution of the eyebrows. Eyes are symmetrical. They look normal. We're going to move on to the ears. Also in a normal exam, I would have the otoscope, and I would use the otoscope pulling the tip of the ear back and using the otoscope to look into the ear looking for the gray pearly membrane or any fluid. Also be able to see if the ear was patent, looking for any extra earwax or anything blocking the ear canal. Here we see that he's got no masses or lesions, no wounds. We're going to palpate here. Tell me if you feel any tenderness. Do you feel anything?
None.
No pain. And we would also do that on the other side as well. At this time, I'm also going to go ahead and palpate his lymph nodes. So we'd start by the pre-auricle. Tell me if you feel any pain.
None.
The post-auricle.
None.
The tonsillar.
None.
The submandibular.
None.
The submental.
None.
The anterior cervical.
None.
The posterior cervical.
None.
And the subclavicular.
None.
Very good. I'm also gonna, if you'll shrug your shoulders for me. Very good. Can you smile real big? Puff your cheeks out. Frown. And stick your tongue out. So I know that all those cranial nerves are intact. Moving on, we're going to go to the nose. So first we're going to inspect. We're looking at the just the landmark of the nose. It's symmetrical. There's no lesions or wounds noted on the nose. Also at this time I would use the otoscope to look up into the nose, and we would look for just patent airways, looking for any polyps or masses, anything blocking the airway. But if you'll just go ahead and look up for me, I'm going to look with my light, and we see that the airway is patent. There are no polyps, and there's no septal deviation. If you will close one nose, take a deep breath. Now do the other side. Kind of snotty, but the airway is patent on both nostrils. So we're going to move down to the mouth. We notice that the lips are moist, they're not dry. There's no evidence of cyanosis. We're going to have you open your mouth. And again, with a light, we're going to look at the tongue. We're looking for just a normal moist pink tongue. We don't want a beefy red tongue. We're looking at the buccal mucosa. It is red and moist. Looking at the teeth, noticing that he has all of his teeth. Looking for any cavities. Lift your tongue up. We notice no masses or lesions underneath the tongue. Everything is pink and moist. Let's stick your tongue out and say ah.
Ah.
Very good. He's got a normal rise and fall of the uvula. There's the tonsils are not inflamed in their normal position. Let's see, and also I would have a tongue depressor in a normal exam, and I would use that to test the gag reflex and to have a better view of the oral cavity. Okay, I think that is it for the hand and the neck. I'm going to go ahead and we're going to look at the neck real quick for just a second. I'm going to hold your neck right here, and if you will take a couple swallows. Alright. So now the trachea is midline. He's able to swallow. He's got no masses or lesions on his neck. If you'll have a seat back here on the bed for me. Like sit to the side. Like put your butt over here. Okay. Alright, so in a normal exam I would have the patient completely undressed in a gown, and I'd be able to see their bare skin. but for this exam, we're just gonna pretend. So I'm gonna start by checking the patient's back. We're just looking at the skin, any hair distribution on the back, looking for any lesions, masses, scars, scratches, wounds. And here we have a normal exam. I'm just going to palpate. You tell me if you feel any tenderness.
None.
No pain.
No pain.
So we have no pain. Now I'm going to move my hands in 3 different spots, and I want you to say 99.
99. 99. 99.
So no tactile firmitus. I'm going to palpate down here. Have any tenderness here?
None.
Any tenderness here?
None.
Just going to quickly percuss the kidneys. Any pain?
No. None.
So no pain or tenderness over the kidneys. I'm just going to percuss the lungs here. We're listening for any resonance, or he has resonance over the lung fields. If you'll lift your arm up for me, I'm gonna palpate the right middle lobe. Very good. Alright, I'm gonna grab a stethoscope and we'll also take your lungs. Alright, I'm just gonna have you take a few deep breaths, and then we'll be listening with the diaphragm on the stethoscope. And we have normal breath sounds in all lung fields. There's no signs of any adventitious breath sounds. So also I'm going to notice the patient's work of breathing. He's not using any accessory muscles. He's got normal chest rise and fall. And we're also going to test for expansion of the chest. So I'm going to place my hands right here. I'm going to have you take a deep breath. Alright, and he's got normal expansion of the chest here. So you can swing your legs around for me. And I'm going to do the same thing with the anterior chest. So again, we're inspecting first, looking at the skin. In a normal exam, this would be, the patient would be dressed and I would be able to see their bare skin. So we would be looking for any hair distribution, any lesions, wounds, scars. So we notice that the patient is again not using any accessory muscles to breathe. He's got normal chest rise and fall. I'm going to go ahead and palpate for expansion. So we're going to do the same thing again if you'll take a deep breath. Okay, and the patient's got normal expansion. So we will, again, I'm going to palpate you. You tell me if you feel any tenderness.
No tenderness.
Any tenderness here?
None.
Alright, and now I'm going to percuss the lung fields again. We're hearing resonance over the lung fields. If you'll lift your arm for me. Alright. And he's got resonance over the lung fields. So now we'll go ahead and auscultate here using the diaphragm of the stethoscope. Just take some deep breaths. He's got normal breath sounds, no adventitious lung sounds noted. So now we will move on. I'm going to have you throw your legs back over there and lay down. I'm going to move over here so you can see. Okay, so we're starting looking at the patient's neck. I'm going to go ahead and palpate. We're going to palpate the temporal arteries since I didn't do that at the beginning. And the arteries are 2+. We're going to go ahead and palpate the carotid arteries. And they are 2+. I'm going to listen to the carotids for any bruits using the bell of my stethoscope. Sorry. Deep breath. And I didn't hear any bruits there. So now we're assessing the patient's chest. We're looking, using I don't know how to say the word, light. The patient would be bare chested, and I would be looking at the chest, looking for any thrills or heaves, looking at the point of maximal impulse here and feeling for any for any heaves or thrills. So we're palpating here into the left sternal border for any heaves or thrills. There's no thrills or heaves there. Also looking at the chest again for any wounds or abnormal anatomy. Patient is normal here. So we're going to go ahead and point out the 5 carotid landmarks or cardiac landmarks. We're starting with the aortic, the pulmonic, Erb's point, tricuspid, and mitral. So I'll go ahead and listen with the bell of my stethoscope for any murmurs at all 5 of those landmarks. We're hearing normal S1 and S2. So no murmurs noted. I'm going to go ahead and use the diaphragm and listen to heart tones. Those same. Alright, the patient's got a strong heartbeat. No abnormal sounds heard there. So we will go ahead. I'm going to feel for pulses. We're going to do brachial pulses. And the radial pulses, we would do both sides. It's got 2+ pulses. Moving down, I'm going to feel for the popliteal pulses, which the patient would be addressed, so I would be able to feel these normally. And then the posterior tibial, 2+, and then I'm going to take your shoes off real quick. And feel for the dorsalis pedis. And here, while we're here, we would note the legs, the hair distribution on the legs, any swelling or redness that we noted. We're also going to look at the feet. Does the patient have any redness or swelling on the feet, any wounds? He's got normal cap refill on the toes. The color is good. Also, looking at the hands, we're gonna check cap refill and it's immediate. We're also noticing the hands, any redness or swelling of the joints, any deformities. His fingers are all normal. Seems to have no pain when moving the joints. Alright. And now we're going to go ahead and move on to the abdomen. So first we're inspecting the abdomen. Again, looking for scars, wounds, hernias, any abnormal anatomy that he might have. And then we're going to go ahead and again assess the aorta with tangent light. So looking for any thrills or heaves at the aorta. And we notice nothing here, so we're palpating. No heaves or thrills. We're also going to go ahead and listen with the bell of the stethoscope to the aorta. Listening for bruise, and there's none. So we're going to go ahead and auscultate the bowels with the diaphragm of the stethoscope. I'm hearing normal, active bowel sounds. And if we didn't hear bowel sounds, we would want to check each quadrant for 5 minutes to be able to verify that there are no bowel sounds. So now we're going to go ahead and palpate the abdomen. So, we're going to go ahead and percuss the abdomen. So we should be hearing dull over the quadrants. Alright, now go ahead and start with light palpation. You just tell me if you feel any tenderness. You have any pain?
None.
Alright, and we'll go into deep. Feeling for any masses. Any pain?
No pain.
Alright, now I'm gonna have you, I would be not in this position, but I would be feeling for any enlargement of the spleen, so I'm gonna have you take a deep breath. Very good, now let go. And then of the liver, I'm gonna have you take a deep breath. Alright. So no enlargement of the spleen, no enlargement of the liver, no pain. So I had a normal exam of the abdomen here. So if you'll go ahead and sit up for me, and you can swing your legs, yeah. Alright, so now we're going to go into the musculoskeletal part of the exam. I'll have you, I'm going to hold my hand against your head. I want you to push against me. Alright, this side. Go forward and backwards. Alright, turn your head to the left and the right. And look up and down. I want you to hold your arms out for me. I'm going to be feeling for your shoulders, so do a little bit of arm circles. Alright, any pain?
No pain.
Just kind of normal range of motion. Hold your arms out in front of you. Bend them. Now push me away, or pull away. Not push away. Very good. Grip strength. Got normal grip strength. Gonna move down to your legs. Okay. Push down like you're driving a car. Pull back. I'm gonna do a few ankle circles. Very good. Lift your leg back one more time. Sorry. I'm gonna test your hips out. So if you'll lift your leg up, bend your knee. I'm going to move it up towards the outside, towards the inside. Any pain?
No pain.
And check your knee, looking for any crepitus. And that one's normal. Let's do the other side. Leg up, bend your knee to the inside, to the outside. Knee up. Knee, no crepitus here, no pain.
No pain.
Okay. Alright, then you can have sit up for me. And going back to the head, I want to feel for any TMJ. So if you'll open and close your mouth. Alright, now move your jaw from side to side. So no crepitus. You have any pain?
No pain.
Pain. Alright, if you'll stand up for me. Alright, I wanted you to take a few steps towards the camera. Walk normal, turn around. Now I want you to do heel toe. So patient has normal balance and posture. You can see. Normal balance and posture. Steady gait. So I'm going to tell you 3 words. I want you to remember them. And I'm going to ask you later after I do a few other things. So if you'll remember black, October, and dog.
Black, October, and dog.
I remember those, and I'll ask you later when we're finished. I'll have you hold your hand. Hold your hand out. I'm going to get you to close your eyes. We're going to test graphesthesia. So I'll write something in your hand. I want you to tell me what I write.
A.
Very good. So normal graphesthesia here. Are you having any pain anywhere today?
No.
No. Can you tell me who the president is?
Biden.
Okay. So the patient is learning-oriented. He's able to answer all questions. He's had a normal exam today. No medical problems. Takes no medications every day. I would assess his vital signs and see if he's had normal vitals at this point. And then I'm going to have you close your eyes. I'm going to use this cotton swab and I'm going to touch you. I want you to tell me where you're touching, where I'm touching.
Left cheek. Under my chin. Right side of my neck. Left arm. Right foot. Right arm.
Okay, so he's got normal sensation here. Can you tell me those 3?
Black, October, and dog.
Okay, so he's got normal memory, again, alert and oriented, and I'll ask the patient if you have any questions or anything that we should talk about or discuss about your health care.
None.
Alright, and that should conclude the end of our exam today.